Hello, my name is Melissa Long. I've been a nurse for a little over 5 years and I've worked in a variety of settings. I started off in the NICU and mother-baby unit, and now I work in public health, mainly with the WIC program and an early intervention program. So I love babies and kids and educating parents on topics regarding babies and kids, which is why I'm working toward becoming a pediatric nurse practitioner. Today I'm going to be discussing a topic I'm really passionate about, both professionally and personally, which is breastfeeding. I'm going to be talking about why breastfeeding matters, disparities in the rates of breastfeeding, and what we as providers can do to support breastfeeding moms. Okay, so pretend you are a pregnant woman, or for you guys that your wife is pregnant. You're super excited about this new baby, preparing and buying all the baby gadgets. You're scouring the rows upon rows of car seats, reading blogs and articles, trying to figure out the safest place for your baby to sleep, plugging every outlet in sight, even spending $300 on a baby monitor that not only tells you the temperature in the room, but also will play a lullaby if your baby starts fussing. And let's not forget that couple $100 baby food maker, because you want your baby to be healthy and not eat that processed jarred baby food. Typical American families spend thousands and thousands of dollars preparing for their new babies in hopes of ensuring they're happy, healthy, safe, and comfortable. Now, what if I told you there was a way to increase your child's immunity, decrease their risk of obesity, diabetes, asthma, even reduce their risk of SIDS? And what if it also helped increase your bonding with your child, decrease your risk of postpartum depression, help you lose the baby weight, and even reduce your risk of cancer? It sounds pretty incredible, right? And the best part is, it's free. You would think women would be clamoring to get in on this, and some are. Breastfeeding rates in the United States have skyrocketed since the year 2000, but there are still some groups of women who have low rates of breastfeeding. Some groups of women who initiate breastfeeding less and do not continue to breastfeeding for as long are women with low incomes, low education, and African American women. You would think that since breastfeeding was free, that women with low incomes would be more likely to initiate breastfeeding, but this has not been the case. The top reasons women choose not to breastfeed include lack of support, lack of education, and difficulty returning to work while breastfeeding. Having a support system that encourages and understands the importance of breastfeeding is crucial. During that first month of breastfeeding, when your baby's trying to figure out how much it needs to eat, your body's figuring out how much milk it needs to produce, you can sometimes nurse for several hours at a time, which is called cluster feeding. If a mother doesn't have a support system that understands this, it can be really difficult to accomplish other things around the house, especially if she has other children. I've been breastfeeding my daughter for almost a year now, but I remember that first month like it was yesterday. And I'm pretty sure our couch has a permanent indentation for where I had to sit for hours and hours nursing my baby. When my mother-in-law came to visit, she would continually question whether this was normal and whether my baby should be breastfeeding for so long. She kept hinting that there might be something wrong with me, my milk supply, even my baby, which had me question myself. Thankfully, my husband also attended the breastfeeding classes with me at the hospital, and him being rather proud of his newfound breastfeeding knowledge, continually told his mother that this was normal and to stop worrying. But a lot of women do not have this support system. I also worked on a mother-baby unit and for WIC, so I had lots of people I could call and ask for advice, and I had support from people if I did have questions about breastfeeding. Many women of low socioeconomic status are single mothers, a lot without friends and family to help. They might not have someone to help cook and care for the rest of the family while they were breastfeeding. And they also might not know who to turn to if they have questions about breastfeeding. Women of low socioeconomic status often have not had as much education regarding breastfeeding as higher income mothers. They might not be able to get off work or have access to a car to travel to prenatal breastfeeding classes. They might not have the time or ability to access quality information regarding breastfeeding, so they're not fully aware of the benefits or mechanics of breastfeeding. Without that motivation to breastfeed, they are more likely to choose formula instead. And without knowledge about how and when to initiate breastfeeding, how frequently to nurse, how to pump and store the milk, and what to expect physically, women tend to opt to what they are familiar with, which is generally formula. Studies have shown that women who participated in lactation education classes prior to pregnancy are more likely to initiate and continue breastfeeding for longer periods of time. When a woman is educated about what is normal, they are more prepared for the hurdles that arise from breastfeeding, because while it seems simple, being the biological norm and all, breastfeeding is challenging, especially in that first month, and for first-time moms. If a woman isn't prepared for the challenges, she is more likely to give up and think something is wrong and then switch to formula instead. Another one of the important reasons women tend to discontinue breastfeeding is because they have to return to work. I hear this every day in WIC, several times a day. Some of these women only take a few weeks off after delivery because they can't afford to take any more time off, or they don't have enough leave accumulated for more time off, and they're often the sole providers for their families. This can be really stressful, so they don't want the added stress of breastfeeding and having to pump while they're at work. And some child care providers don't even know how to handle breast milk and require mothers to only use formula. And some women don't know their rights regarding pumping at work. Some women know their employers are supposed to let them pump, but they're afraid to ask about it and push the issue for fear of losing their jobs. Some employers are familiar with the breastfeeding laws regarding pumping, but do not know what a pumping-friendly space looks like. Even in my experience as a nurse practitioner student, when I went to the Athens campus for lab one day, I asked to take a break to pump, and I was directed to a multi-stall bathroom to pump in. I have an electric breast pump, so I would have had to stand at the sink, plug it in to pump, open to everyone, and I would refuse to pump in the most contaminated room possible. So if, in my experience with advanced practice nurses who generally have some breastfeeding knowledge, and that was my experience, I can't imagine what other women have to face in other situations in their workplace. As nurses, we are charged with helping increase the health of our communities. Therefore, it is our duty to support and encourage breastfeeding moms. As providers, there's a lot of ways we can help. We can help with the initiation and duration of breastfeeding by eliminating those three common barriers: lack of support, lack of education, and worries about returning to work. Healthcare providers could be a woman's greatest breastfeeding support system, whether it be right after delivery, during mom's 6-week postpartum check, or when they bring their child in to the pediatrician for an appointment. There are several opportunities for providers to encourage, ask about problems with breastfeeding, provide support, or referral to a lactation specialist if you're not comfortable providing answers to breastfeeding questions. If a woman has a low income or doesn't have insurance to see a private lactation consultant, you can always refer them to their local WIC clinic, who has lactation consultants and counselors on site every day who can assess breastfeeding problems and educate moms for free. We can also help educate mothers about the importance of breastfeeding during prenatal visits if you work in women's health, or just among your family and friends who are pregnant and are wondering whether they should breastfeed. Just one conversation about the benefits of breastfeeding, especially coming from a healthcare professional, can motivate a woman to try to breastfeed. Healthcare providers can also play an important role in supporting a breastfeeding mom returning to work. As I stated previously, many women do not know their rights regarding pumping at work, but in 2010, the Fair Labor Standards Act was amended to require that employers provide break time for women to express milk for the 1 year following birth. This time is not required to be compensated, and employers with under 50 employees can deny this break time if they say it imposes undue hardship. But it is important that we educate mothers we come in contact with because they might not know this is a law. As advanced practice nurses, especially, we can also support healthcare policy that makes it easier for breastfeeding mothers to return to work and still successfully breastfeed. Breastfeeding has so many well-established benefits for both mom and baby, but breastfeeding is definitely not easy, especially for moms with low incomes and low education. It can be very challenging in the beginning to establish breastfeeding, and it can be really hard to continue if mom has to go back to work or school rather quickly. Healthcare providers can be crucial in the mom deciding to initiate or continue breastfeeding. With continued support and education from healthcare providers, we can promote healthier babies, mothers, and communities. Thank you.